Hi, this is Blair. I'm one of the pharmacists here at Primary Plus, and today we have this short video for you. We're going to talk you through your rescue inhaler and also do a demonstration on how to use it. There are several brand names that are all rescue inhalers. When you get yours home, it might be called Ventolin, ProAir, or Provenal. They all have the same active ingredient called albuterol, and their use is very similar. We're going to be using ProAir for our demonstration today, but if you have Ventolin or Provenal at home, still watch the video. You'll find it helpful. You just might notice that the colors on your inhaler are a little different. The dosage for all the rescue inhalers is similar. It's going to be something like 1 to 2 puffs every 4 to 6 hours as you need it. That means you'll use it when you need it for symptoms like shortness of breath, wheezing, coughing, or just trouble breathing in general. You can also use it when you know you're going to be doing something that brings your symptoms about. So like before exercise or before you're outside around allergens and pollens. It is really important that you only use this inhaler as you need it. If you use it around the clock, like every 4 to 6 hours, that drug's just always in your body and it gets kind of used to it. So when you have these symptoms and you use your rescue inhaler, it just won't be as effective. A lot of the side effects of this drug are related to the fact that it raises your heart rate. So you might notice that your heart rate is faster or a little irregular. You could notice a headache or dizziness. Other than that, it's really just maybe a sore throat, and it can sometimes cause an upper respiratory infection. When you receive your prescription, it will be in a cardboard box, and the inhaler might be in a foil pouch inside. It should be stored within this packaging until you're ready to use it. Store it in a dry place at room temperature, away from heat and sunlight. Once you're ready to start using your inhaler, remove the inhaler from its packaging. These inhalers must be primed when you first unpackage them before you can use them. You do not have to do it every time you use your inhaler, only when you open a new one, if you drop your inhaler, or if you haven't used the inhaler for more than 14 days. You should see a black dot on the dose counter when you open a new inhaler. When you're ready to prime it, hold the inhaler upright and shake it well for 5 seconds. Pull on the mouthpiece cover to reveal the mouthpiece. Point the inhaler away from you, and then press down on the top of the canister to release a test spray. Repeat this step 3 more times to complete the priming process. The dose counter should now reflect a number, and the black dot should be gone. When you're ready to use your inhaler, shake it well for 5 seconds, and then remove the mouthpiece cover to check for foreign objects in or on the mouthpiece. While still holding the inhaler away from your face, breathe out for as long as you can. Be sure not to breathe directly into the mouthpiece. After you've exhaled completely, bring the mouthpiece to your lips and ensure you've closed your lips around the inhaler. Now take a deep breath in, slowly, while pushing down on the top of the inhaler to dispense the dose. Next, remove the inhaler from your mouth and hold your breath for up to 10 seconds or as long as comfortable before exhaling normally. If you need to do a second puff, wait 60 seconds before the next dose. Once you've administered your dose, make sure to recap your inhaler. You should hear a little click, and then store it in a cool, dry place where you can easily access it in case you have symptoms. You can use this inhaler until the dose counter on the back says 0 or the expiration date, whichever comes first. And it's also important to note, if you're using this because you're having trouble breathing and the inhaler doesn't help you, make sure that you seek medical attention immediately. Now we're going to show you how to clean your inhaler. You should clean your inhaler once weekly to prevent any buildup that might block the delivery of the medication. Take the cap off the mouthpiece and remove the metal canister from the plastic actuator. Then, hold the actuator underneath the faucet and run warm water through it for about 30 seconds. Then, flip the actuator and run water through the mouthpiece for an additional 30 seconds. Shake as much water as you can from the actuator and then let it dry completely. Overnight would be best. I know we went through that information kind of quick, so feel free to rewatch the video, or if you have any questions, please contact any of our pharmacies at any of our locations and we will be happy to help you.